training, and what was your impression about being a social worker at that time?
Yeah, well, I started working in the Midlands in England, and I was basically working with children and families. I'd always thought I would work in mental health with adults with mental health difficulties or issues, or because as well as the adolescent unit that I mentioned, they also worked in a mental health day centre. That was actually also very influential. Now I think about it, on what I ended up doing with solution focus. Because so going back, sorry, before the social work course, I spent a year working in a mental health day centre, run by an organisation called Mind, which is a mental health charity in England or the UK. And the day centre I worked in Liverpool, and some of the staff that ran the centre, it was quite radical in some ways. Where I came across some radical ideas of service user involvement and service user control of services. And so I was reading books by people like Thomas Satz and R.D. Lang and people like this. And so I had this idea of, and there was a magazine called Asylum, a magazine for democratic psychiatry, which fitted with these ideas about service user or survivor input and control and having democratic services. So I was fascinated by mental health as a field to work in, and but after I qualified as a social worker, my first job was a sort of general social work job. It was called generic social work. The idea being, from the late 1960s onwards, that social workers worked with all client groups, children and adults, older people, disabled people, etc. And I liked that idea. And I mean, partly it was I wanted to have a wide range of experience. But, so I had a job in a generic social work team. But what I found out when I started working in that team in 1989 was that the emphasis was all on children, because of the real shift into child protection work, which I think happened for all sorts of reasons, including political reasons. So the training that I did, my education in social work at Sheffield University in the late 1980s, didn't really connect that closely with my experience of being a qualified social worker, the actual work that you do once you're qualified. And I think it's partly to do with the shift into this quite managerial sort of social work, where in children's work the emphasis was on assessment and child protection, protecting children from their parents, basically. And what I'd learned at Sheffield University, what I'd learned was doing social work, using practice models, using methods of social work to help people to make changes in their lives. And then it didn't really fit that closely. And that's one reason why coming across solution focus work really fitted and helped my social work, because there was a practice model, solution focus practice, that fitted with the actual context I was in as a social worker, where the practice models that I really liked, task-centered social work, behavioural social work, other models, I hadn't been able to fit them into the context I was working in as a qualified social worker. Yeah.